Hello, everybody. Good evening from Europe, or good morning if you're watching from the US or Canada. I see we are a smaller group today, but I think some of you are nevertheless attending for the first time. So I would quickly like to introduce myself. My name is Martin Junkebauer. I work with the International Society for Medical Laser Applications and Weberneedle, a German manufacturer of low-level laser technology, for 7 years now. And I'm also the co-founder and co-president of the ISLA research group. We focus on conducting research in the area of antimicrobial photodynamics therapy. And I'm very happy to welcome you to our webinar about the application of low-level laser therapy in veterinary medicine. It's a webinar that Claire and I really wanted to do. We are very passionate about helping animals. We really love animals. And we are very convinced that low-level laser therapy can make a tremendous difference for many animals in terms of their health and life quality. And by that, of course, it can also improve the life quality of all those humans who love their animals. So we are really glad to do this webinar. And I think we have the perfect speaker here today, Dr. Marlene Siegel from Florida in the US. She's a doctor for veterinary medicine, and she's running one of the leading veterinary medical centers in the US. And she has a really great life philosophy. She says she wants to make a positive impact on people, pets, and the planet. But I don't want to tell you more about her because she's here live with us. And I think she's going to introduce herself. Dr. Siegel, hello. Welcome. It's great to have you here. And yeah.
Thank you, Mark.
You can introduce yourself.
Thank you. I'm so honored to be here, and knowing that during a really unique time in the history of mankind, we've never seen a scenario like we have right now with a worldwide type of pandemic going on. And I think it's an opportunity for all of us to take a moment and realize, why are we actually here? You know, before this happened, our lives were crazy. We were running from one place to the next. We didn't have time to slow down. We didn't have time to really smell the roses, as they say. And now we had an opportunity to decide, how do we want to perceive this experience? Because that's what it's all about. Life is all about perception. Do you want to see the good side of it, or do you want to see the bad side of it? And I think this has been an opportunity for people who really want to make an impact in the world to find their voice and to take those actions to really step up to the plate and do something that's going to make a big difference. And that was for me. You know, I was already doing a lot of work in this area, but now I have an opportunity to be a bigger voice, to be a bigger version of me, to really draw that line in the sand and say, what is it that we are really trying to create here for ourselves, for our families, for our pets, and for the planet? So I'm honored to be here, and I'm excited to share my work. I think for the past 40 years, I've been working towards making a lifestyle out of medicine, because it isn't what we do, it's really who we are. And that's what I want to share with you in my presentation today, are all the different things that I do in my practice that I actually live myself. These are my principles. And I'm working really hard to create programs to teach veterinarians how to integrate alternative medicine into their practices. And I'm also working on creating programs that teach pet owners how to integrate alternative medicine into their lifestyles for themselves and for their pets.
I know that you are doing amazing work, and I also know that you have a strong focus on preventing diseases and treating the root causes of diseases. And I think that's the way medicine has to go. And I think it's also uniting the physicians that use low-level laser therapy in their practices. So we pre-recorded your lecture, and so we already know it's going to take 80 minutes. Would you quickly like to tell us what we can expect? What will you talk about?
So the first part of my lecture, I really set the stage for why this is important. Because if we don't understand why we're doing something, you know that principle about you can give somebody a fish to eat and they eat for the day, but if you teach them how to fish, then they eat for life. This was really the principles of how we need to be thinking differently. It's that paradigm shift where we start taking responsibility for our actions. And so that's step number one. And then I'm going to go into a plan of how I implement this in my lifestyle and in my practice and how I teach my owners. And then we're going to show you case presentations of proof that this works And it doesn't just work, because a lot of our traditional things would work as well. But the difference between what I'm showing you is not only did it work really quickly, like we're talking in some cases days, but it also was long-term. We didn't get relapses. So that's really the difference between treating the root cause of the problem and the Band-Aid symptom-based medicine that we've been taught to treat in the past.
Sounds great, and I'm excited to hear it. The good news is also that we will have you live with us for a Q&A session after your lecture. I think we will have about 25 minutes for that. And dear attendees, the way it works is you should use the chat box, which you can find on the right side of your screen. And you can let us know what you would like to ask Dr. Siegel, what you would like to discuss. And it would be helpful for us if you let us know what you would like to ask her as soon as possible, so we can try to organize and cluster everything a bit. So please, whenever you have something that comes up, let us know. And also let us know if you have any technical problems. You can use the chat box for that as well. And we can send you direct links if you have technical problems. We will also be sending you product information. And yeah, I think that's all you have to know for now. So the lecture is going to take 80 minutes. And yeah, after that, we'll have like 25 minutes for Q&As.
Enjoy, guys.
I think we can, yeah, enjoy, exactly. So I think we can mute our audio again, turn off the cameras, and I'm going to play your video.
Thanks. Welcome, everybody, to Light the Way to Healing Using the Body's Biology. Now, in my private practice, I see a lot of referrals, and I always ask people, what is it that they hope to accomplish when they come to see me? And the #1 request that they make from me is, can you make my pet live forever? Now, I know that's not feasible, and they know it's not feasible as well, but our goal is to provide the highest quality of life for as long as we can achieve. And so that's what this presentation is all about. How can we use light to accomplish that? Needless to say, we are living in unprecedented times, and being kind of spiritual as I am, I think that everything does happen for a reason. So taking a moment to really acknowledge these unprecedented times, maybe it's an opportunity for us to break that non-sustainable lifestyle, that rat race that we were in, and replace it with one that is better. Maybe this is an opportunity to create things that we haven't seen before or thought of before, but that through necessity being the mother of invention, maybe we can come up with new things that would help us achieve our goals in living a healthier lifestyle. And it's the opportunity to find the blessings in the experience through the contrast, because if we didn't experience what we don't want, we would never be able to truly focus on what we do want. And it's an opportunity to become the best version of you, right? What I saw during this COVID time was the worst of people, and then I saw the best of people. And I chose to show the best of me. And it's an opportunity to awaken our consciousness so that we become that deliberate creator that we came here to be. So as we move on, how old should our pets really live to be? Well, would you be surprised to know that in the World Guinness Book of Records, we have Cream Puff, who was owned by a plumber in Texas, who clocks in at 38 years and 3 days. She is not the enigma. This is Maggie, who was living in Australia, world record holder in 2016. She was 30 years young, and her owner attributed her longevity to the fact that she ate a raw diet. She lived on a dairy farm, so she ate a lot of placentas and raw milk. She had high intensity exercise every day. She did intermittent fasting on her own, and she had a wonderful lifestyle where she was loved dearly. And look at her, she's a little old, but you know what? She's getting around and has a happy life. So despite the fact that we have a pill for every ill and a diet for every disease, we are still seeing a rise in dis-ease. We have cancer rates right now in dogs that are 1 out of 1.65. Guys, that's nearly 100% of our dogs getting cancer. Cats, they say, is 1 out of 3, but I think that is very underreported, as I'm seeing a ton of cancer in cats. And then if we add obesity, autoimmune disease, arthritis, allergies, gastrointestinal disease, we're looking at nearly 100% of our animals having health challenges. And the scariest part of all is, despite all of this that we have in modern medicine, the life expectancy of our pets has gone down by 7 years. And we're not doing it just to pets and to ourselves, we're doing it to the planet. The World Wildlife Fund did a study with 2 major universities studying vertebrate species, and it was a 44-year retrospective study that just ended in 2014. And here's what they discovered. There's been a 58% reduction in the population of all vertebrate species on this planet. The bird populations are down by 35%, unless they live near fresh water, and then they're down by 78%. When a species reaches 72% reduction, they are at risk for extinction. I think what we have learned is that we can't survive without nature. We truly need them to exist together. And I think it's interesting during this COVID time that we were blaming viruses and blaming bacteria and blaming all this stuff for why people were so susceptible to getting sick. And the reality is we're getting sick because we're toxic. And we really need to be taking the time to look at how can we improve our immune systems? How can we improve the planet so that we are healthier, not coming up with another pill or another treatment? Which brings us to our genomic makeup. Now, we talk about these bacteria and viruses as if they're the enemy, and we're taught, oh, you got to use anti-parasiticides and you have to use antibacterials and anti-this and anti-that. Well, honestly, we are 10 to 1 more bacteria, fungi, and parasites than we are human cells. And we're 100 to 1 more mitochondria than we are human cells. So when we look at the genomic makeup, we have this itsy bitsy little piece that's called us. And then everything else is what makes up what we consider our human species. So in reality, we are the host universe for all these organisms. And maybe the reason why we're seeing this upheaval and this battle going on is because we haven't been a very good host, and we created this inability for these organisms to survive in harmony. So what we're going to discover today is a paradigm shift. How do we move away from treating symptoms, which we are really well trained to see, to understanding the body's biology? We're going to learn how low-level light therapy works on a cellular level, and then I'm going to show you proof that it works through case presentations. But the first thing we have to do is we've got to shatter some old beliefs, because, now listen guys, you know what you know, and you don't know what you don't know. I love this saying that Wayne Dyer had. That's going to come up in a minute. But what if we're missing the elephant in the room? What if really it's not about the symptoms, but it's about the biology? So my little elephant on the chair is, sometimes even if I stand in the middle of the room, no one acknowledges me. And I think that's what's happened in our medical training, is that we've lost our ability to really understand this amazing biology that the body has, this innate intelligence. And all we're doing is focusing on the symptoms, and we're missing the real understanding of how the body works. So my favorite saying from Wayne Dyer is, when you change the way you look at things, the things you look at change. And that's what we need to do in medicine. We need to change the way we look at things so that we can create those outcomes that we really know are important and what we're truly striving for. So here's my promise to you, is that I'm going to help you find the answers that we seek in nature. Now, we talk about the roots of disease, and we just talked about parasites and the mitochondria and fungi and all this. And what's amazing to me is that it's these organisms that live in and on our body that are actually communicating with the mitochondria, giving signals to let the mitochondria know what we need to turn on and what we need to turn off. It's not your brain telling your bacteria or telling your mitochondria what you need. It's the microorganisms that are communicating through a fiber optic network that are getting signals from our experiences as we produce emotions. We create neurotransmitters that are giving information to the microbiome, which then relays that information to the mitochondria so it knows what we need to have happen. One of the things that we are finding is that glyphosate in particular, but a lot of toxins, are disrupting this communication network. So even if we're sending signals, we're finding that the mitochondria are living in this little bubble going, la, 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 I can't hear you. So as we go through this presentation, I'm going to show you things that we can do to repair and restore this communication so that we support the body's biology. Biomimicry. This is where I want to help you to see that all of our answers really do lie in nature. Biomimicry is the new biology where scientists study the strategies and the patterns that plants and animals and insects use to not only survive in the world, but to thrive in the world into future generations. So when we talk about biomimicry, we're looking at insect species that use the principles of nature. They do things that are sustainable and they obey the laws of nature. Man uses biotechnology, and we use everything on the periodic chart, even the toxic stuff, and we wonder, why are we having a problem? Now, I am not going to make you guys go back and read the Krebs cycle, but what I do want to point out through this picture is that we are this whole vat of different communications, different things that are happening inside at the cellular level. It's not just random that things happen. And when we understand how we can turn this cycle up and we can turn it off and we can enhance it, that's where we are really affecting our health and our survival. And I will tell you right now, you're going to see cases of cancer that were gone in under 10 to 16 weeks using these principles. So I call it the KISS principle. Now, we all know the KISS principle is keep it simple, stupid. But nature doesn't do what is stupid. Nature does what is sustainable, because what is sustainable is successful. That's where we need to shift to. Here are some of our modern day challenges. We are going to have no antibiotics in 20 years. This is predicted through the American Medical Association's website, because we have such a high rate of antibiotic resistance happening. We're using tons of antibiotics in our food systems. We're feeding it to the animals that we're eating. So even if we're not taking it directly, if you're eating non-organic foods and animals that are raised on feedlots and they're loaded with antibiotics, you are getting that in your system. 5G is already starting to hit. We've seen it in some cities. It's considered potentially one of the most deadly threats to mankind. We know it's damaging our DNA. And then the complexity of disease that we are seeing today is the highest we've ever experienced. When I started practicing medicine nearly 40 years ago, I saw 1 or 2 cancer cases a year. I am now seeing 4 to 10 cancer cases, sometimes in a single day. The predictions are that we as a species could be extinct in under 70 years based on the disruption of the carbon cycle and the rising infertility that we're seeing. Remember, if you reach 72% of no growth in your species, you're at risk for extinction. We're in the high 50s. And it could stimulate fear, right? Fear is future events appearing real. But I find that fear doesn't help us. Now, I had the opportunity to eat fire, and I'm going to show you the video. Watch the intensity on my face. That is real fire, and I was afraid I was going to light my hair on fire. I was afraid I was going to miss my mouth. I had some real fear that this wasn't going to go well. And I will tell you that after that experience, something changed in me. It was unexplainable that the thought of being afraid of something and realizing that it was just a future event that appeared real and that I could overcome that helped me to reshape what I considered fear. And I changed that acronym to face everything and rise above it, because there's always a solution. So fear is a state of contraction. You become very limited. You can't problem solve. You get stuck. You're in high sympathetic tone. We all experienced that with the whole COVID crisis, right? The first 2 or 3 days, I even experienced it because we were watching the news, and I'm expecting stormtroopers to come in with face masks and, round people up from their homes and put them on trains and take them to FEMA camps. And, I had all of this fear that started out, and then something changed in me, and I said, no, this is just contrast that I'm going to use to focus on something different. And with this something different is love. So the only 2 emotions that drive behavior is fear and love. And we have a choice on which one we choose to have. I call love the acronym of letting out the luminous energy. And that's what we are. We're light beings. We're energetic beings in an energetic universe. And I think it's about time that we started to capitalize on that. When you are in a state of love, we are expanded. You are limitless. You are creative. That's how we're coming up with all these amazing solutions. But most importantly, we are fearless. So Einstein said you can't solve problems with the same mindset that created them. Totally true. He also said insanity is doing the same thing over and over and expecting a different result. Come on, guys. We've seen what this allopathic model with the drugs and the chemo and everything has been getting us. And I'm not saying there isn't a place for that, but it isn't the only tool in the toolbox. And it isn't getting us where we want to be, as we're seeing rises of disease being greater than any time in the history of mankind, and our life expectancy in these pets diminishing. So let's use this face everything and rise to our advantage. Let's talk a little bit about today's pet parent, because they are very different than the pet parent of 40 years ago. There is a much greater bond with our animals. We call them soul pets because there is definitely a different relationship in these animals and their pet parents. Our pet parents are very educated. Dr. Google, he gives us a lot of information. Not all of it's great, but people come in and they know a lot. People are loyal to outcomes, not people and not clinics anymore. They want to see results. And if they're not getting the results with you, they are going to go elsewhere. And they expect more at economical prices. They want instant gratification. But most importantly, they want to see results. The cases that we're experiencing have changed. Back when I started practicing, flea allergy, dermatitis, ticks, we would see the main therapies that we had were antibiotics, steroids, and NSAIDs for the vomiting and diarrhea cases. And now what we're seeing is problems with resistance to antibiotics, the unacceptable side effects that owners know. They don't want those side effects anymore. They want safe and effective therapies. So the challenges that we're facing today is that the diseases that we have are more difficult, they're more challenging, and we need safer and effective tools. So here's the old paradigm. We named it, we blamed it, and then we cut it out, we nuked it, we burned it, we poisoned it. It ain't working. So the new paradigm is, how do we treat the body's biology so that we allow the innate wisdom of the body to work with us in synergy, in cooperation, and get the effects that we want. There's a little mitochondria in there. That is a center focus for what I do. Now we're going to jump into photobiomodulation, which is also now called low-level light therapy. So think about light as a nutrient. When the sun comes out, we're talking about that full spectrum light that we already have, but we aren't outside anymore. Our pets aren't outside anymore. So I think we are actually light deficient when you really come down to it. So we have these tools now. Remember that the challenges that we have are what create the need to come up with answers. And we have the blessing of Dr. Michael Weber in our lives, who has taken this instrument and developed a way for us to be able to take light therapy and use it as a tool. So electromagnetic radiation is made in nature. We didn't invent that. Radio waves are emitted by stars and gases in the space, and ultraviolet is emitted by the sun. X-rays are emitted by the hot gases in the universe, and the universe itself is the biggest generator of gamma rays. Electromagnetic radiation for dummies. We just have to cover this really quickly. Photons contain energy, and energy is defined by the amount of energy that they carry. That's how it gets the names. So energy can be defined as electron volts. It can be called wavelengths, and then it's described in meters. And if it's in frequency, we call it cycles per second or hertz. But these are all interchangeable mathematically. So a little nerdy news for us. Nitric oxide, NO, builds up when we're sleeping, when we're stressed, and when we're exposed to toxins. Interestingly, red and infrared light increases ATP production. Remember, ATP is that energy that drives our body. And it increases it in the mitochondria by displacing the nitric oxide off the oxygen receptor site, thereby allowing more oxygen to bind to the receptor site. So when there's more oxygen, you can make more ATP. Now, we're not going to cover hormetic stressors in depth, but hormetic stressors are short bursts of intermittent stress that create oxidative stress, resulting in the production of free radicals like reactive oxygen species at the cellular level. And though it sounds like that might be a bad thing, it really is a good thing, because it's one of the signals that is sent to the mitochondria to tell the mitochondria, hey, we need you to turn on the antioxidant response element so that you make more superoxide dismutase, more catalase, more glutathione peroxidase. We can take all the antioxidants we want in a pill form. But if we don't turn on our body's ability to make them internally, we aren't really accomplishing what we're trying to accomplish. So by increasing the internal antioxidants, we're actually helping cells to detoxify better. We're creating mitochondrial biogenesis, which means we're making bigger, better mitochondria. And it also helps us to have that positive adaptation to stress so that in the future we are more successful as a species. So now we're going to talk a little bit about wavelength. We're talking about light. And as you can see from this chart, that the lowest energy at the top has the longest wavelength. And then as we go down the chart, we have the highest amount of energy with the shortest wavelength. What we're going to focus on today, and I don't know if you can see this, but I'm putting my cursor in the middle where we're talking about the visible light waves. So this is the visible light spectrum that we're going to talk about, and we can see that we have violet and blue and green and yellow, orange and red, and there's also infrared. And these light frequencies have a particular wavelength. And it's not a surprise to us that our body has the ability to absorb these various light waves, and it does something metabolically to us. So the blue light wave, it helps to stimulate the mitochondrial respiration. It has antibacterial effects. It helps to free up nitrous oxide. So it has, and of course it increases circulation, microcirculation. And the spectrum that our blue light is between 450 and 495 nanometers. Then we have green light, and it helps to bind hemoglobin. It improves oxygen uptake and all these different mitochondrial effects. Dose dependent. Then we have our yellow light, which also stimulates mitochondrial respiration, is a strong detoxifier, and it produces serotonin, or helps promote serotonin and vitamin D metabolism. Red light, also about the immune system and helping to increase the immune system's ability to get rid of the pathogens that aren't helping us and stimulate all kinds of cellular respiration. So this is an example of low-level light therapy. This is an intravenous light that I have put an IV catheter in, and then you can see the red light, and it is literally in my vein and lighting up my red blood cells, which will then carry that light throughout the body. We also have a shower head where we can use the different lights and shine them outside on a topical application. We have a watch which has all the spectrums, and we can shine that on the areas where the vessels are close to the skin surface. And then on the right-hand side of your screen is the multi-radiance medical laser, which is another handheld laser that has red and infrared light spectrums in it. So how does it really work? Well, when I discovered the work of Dr. Gerald Pollack, who is still alive today, how cool is that? This is current active modern science happening right in our lifetime, is that he discovered that there was 4 phases of water. Remember that you know what you know and you don't know what you don't know? Well, we were taught that there were 3 phases of water. There's not, there's 4 phases. There's this gel phase that's in between the liquid and the solid phase. And Dr. Pollack called that the easy zone, named after the exclusion zone, because what he found was when that easy zone, which surrounds the cells and the organelles, when it expands, it pushes the solutes out into the bulk water, looking something like this. So around the cell, we see a negative charge. That's the easy zone. And as it expands, it pushes everything else out into the bulk water, creating this positive zone. And that's what creates the ability of clouds to be able to hold their shape and to have surface tension on the water. So this is what it looks like using live blood analysis. And live blood analysis is where we take a drop of blood and we put it on a microscope slide and we look at it under high power. This is light field microscopy. You might have heard of dark field microscopy, but this is light field, and we're able to see the cell's morphology. So in a normal, healthy individual, we will see the red blood cells separated. And the job of the red blood cell is to pick up oxygen from its surface area, deliver that to the tissue, and then it picks up the waste products from cellular metabolism, and it delivers that out the body, out the lungs and the organs of elimination. But when you have a condition called rouleau, where the cells are all stuck together, well, just looking at it, you can see that well over 60 to 75% of the cell's surface area is now covered. So it won't be able to do the same level of cellular metabolism that it needs to pick up enough oxygen to deliver to the tissues and to pick up waste products and deliver it out the body. What I discovered is that there are many ways that we can affect the easy zone and expand it. And when we expand that easy zone, the cells separate, they become more active and moving. We're going to jump over to the autonomic nervous system for a minute, because this plays a really huge role in our health or lack thereof. So the autonomic nervous system has 2 branches. We have the sympathetic and the parasympathetic. And as I demonstrated for you, they live on a teeter-totter from each other. When one is up or on, the other is off. So our sympathetic side is our short-term survival. It is what allows us to survive when there's danger, when the saber-toothed tiger is about to jump out and eat you. And then your parasympathetic side is your long-term survival. It's the rest, digest, detoxify, reproduction side. But because they can't operate at the same time, when that saber-toothed tiger is chasing you, you aren't caring if you're hungry, you don't care if you have to go potty, and all the other systems are turned off. All you need to do at that moment in time is survive. And if we ever watch like a National Geographics, you see the lion chasing the herd of elk, and they're all running like crazy. Well, everybody's in high sympathetic tone. But once that lion kills something, the herd can be just a few 100 feet away, and they go back to grazing again, because now they're going back, they're alert, but they're going back into parasympathetic tone. We all have heard the term the SAD diet. It's the standard American diet. I know we're internationally speaking right now, so I'll have to come up with a good acronym for you guys that aren't in the United States. But the SAD diet is the standard American diet with all the horrible oils that are used, and all the processed foods and the sugar, etc. But I also coined the SAD day, which is the standard American day that we do experience worldwide. Well, what does that look like? It looks like waking up by the alarm clock and hitting the snooze a couple times because you're exhausted, and then eating some kind of a flour, sugary, processed breakfast. And then it's the stress of getting the kids off to school and fighting traffic to get to work. That was, pre-COVID, of course. And then it's all the after school activities with the kids, and then nobody had time to take out anything for dinner, and you're running from one place to the next. So you grab a burger at the burger place, and of course that's not organic, and it's cooked in canola oil, yuck, yuck, yuck. And you're exhausted So you take a nap and then you opened your mail and you found your credit card bills and you just wanted to punch somebody, usually your spouse, and then you stay up late at night and you're working hard and you're dealing with the kids and they have their needs, and before you know it, it's 2:30 in the morning and you haven't been to bed yet, so you're sleep deprived. Just think about it, guys. Is any part of that day what you experience? Because if it is, that's the day that the saber-toothed tiger is chasing you. Your body does not know the difference between the ancestral saber-toothed tiger and the day that you're living. So you're living in high sympathetic tone, which means you've turned off your parasympathetic nervous system and your body is not able to repair, digest, or detoxify. Why is that important in a conversation about animals? It's because they entrain to our energies. So when you are giving off these neurochemicals of stress and anxiety and fighting and all this stuff that we're living with on a day-to-day basis, our animals are entraining to that. I think they actually play a role in helping us to feel better. Maybe they volunteered for the job, so that when we're all stressed out, who comes over to us and shows us unconditional love? They lay next to you, you pet them, you feel better. They just lighten the world up for us. And we can do the same thing by going out in nature and sitting under a tree or hugging a tree or eating some fresh vegetables that you just picked out of your garden, and just add such joy and gratitude to your life. So this is a real problem that we're facing today with our pets and our pet parents. So the autonomic nervous system that we just described, the vagus nerve, we have known for years and years that the vagus nerve is what stimulates the parasympathetic nervous system. When you stimulate that part of the nervous system, you get high parasympathetic tone. It stimulates the rest, digest, and detoxify system. And then that comes from the dorsal nerve root of the parasympathetic nervous system, which we have just recently discovered there are two roots. When we stimulate the dorsal root, we have mitochondrial biogenesis. The mitochondria get strong, they make more energy, which fuels more metabolic functions, and we have the ability to heal and repair. But there is another side of the vagus nerve that is called the ventral root. And when that ventral root is stimulated, you get that possum effect, you know, where the possum thinks it's going to die, so it just plays dead. Well, what happens is our bodies, when we think that there is so much danger that you are going to die, and that could even be the sad day, your mitochondria get that signal and they go in what is called a cell danger response mode. And basically what happens is they go hide in the bunker. When they do that, they lower the amount of ATP production because they're not out there thriving. They're just waiting for the battle to get over so they can come back out and see if they have a body to live in. So this cell danger response mode is a huge, huge, huge important piece of information that has just recently been discovered. And it's the reason why in the human side, so many of the people who are tragically ill can't repair, is because even though they're doing all the right things, they're stuck in this cell danger response mode. And until they can get out of that, they can't get into the dorsal root and start being able to repair and regenerate. Red light, there are papers now showing that red light stimulates the dorsal nerve root. They don't call it the dorsal nerve root because they don't identify the two branches, but they have seen that these individuals go into a parasympathetic state. They can make more ATP. The mitochondria are going through mitochondrial biogenesis. So it has to be the dorsal nerve root that is being stimulated by low-level light therapy, red light therapy. I want to share with you my 6 keys to healing, because I don't think nature does anything randomly. And I've discovered that when I follow these 6 steps, which was a gift from download, that I discovered this, that we have successful outcomes, not only in prevention of dis-ease, but also in the healing of dis-ease. And there's no shortcut. I have people all the time come to me and say, what's the dosage of ozone I should use? Or what color of light should I use? Or what nutraceutical should I use? And I have to stop them and say, no, 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 no. You have to build the foundation from the ground up. So number 1, we have to stop polluting the body. And when I'm teaching this, I teach about species-appropriate diet, healthy water, cleaning up the toxins in the home, the EMF pollution, and even the ants that live in our brain, which are your automatic negative thoughts. Because remember, they're producing neurochemicals that are creating a signal to your mitochondria and your microbiome and turning on pathways that may not be the ones that you want turned on. The second area that we talk about is nutrients. We know that the body has certain essential nutrients, vitamins, minerals, and fatty acids that it has to have in order to function. Guys, it hasn't been in our food in at least the United States since the 1930s. So it's really critical that we establish these essential nutrients, the one the body can't make, and we make sure that they are in the body. The third step in my program is healing the leaky gut. And we have a variety of tools that we do this with. One of my favorite, I'm going to throw a product out there right now, is the Ion Gut Health. This is a product from Dr. Zach Bush's company. And I mentioned earlier that there's a communication between the microbiome and the mitochondria. Well, that's destroyed by glyphosate. And in studies with immunofluorescence, we've been able to show that Ion Gut literally heals the tight junctions, restores the actin filaments, and repairs the communication network between the microbiome and the mitochondria. So super important product. Everybody needs to be on that product. And so I just wanted to share that. And then my fourth area in my program is detoxification. Now we detoxify all 6 organs of elimination: the kidney, the colon, the lungs, the liver, the skin, and the lymphatics. And though they all are important, I think the 2 most important organs that are organs of detoxification that I have found is the liver and the lymphatics. So we have a special machine that we use to do lymphatic therapy for all of our patients, even the healthy ones, because we just have so much toxins and we don't live the lifestyle that allows our lymph to move properly. So we have to do something to aid that. And then, of course, the liver. Mr. Liver has hundreds of jobs and I think deserves a lot of our attention in helping to support and detoxify. Number 5 in my program is the mitochondria. We've spent a ton of time talking about ways to increase mitochondrial biogenesis. At the end of the day, that's the name of the game. If you don't have enough mitochondria and you are not making enough energy, your system is going to say, hey, I think we just need to go recycle and go get a new body, because it's not going to have enough energy to do its job. So we really need to focus on the mitochondria. And last but not least, I work in the realm of clearing trapped emotions that are associated with our dis-ease. So when do we use low-level light therapy? Because that's what this talk is all about. Well, I think it would be a lot faster if I told you when not to use it, which is never. So one of the things we want to talk about is chronic pain, arthritis. I see more arthritis now than I have ever seen in our animals. And I notice it's a shift. It used to be arthritis of the joints, hip dysplasia, and knees. Now I see over 80% of the arthritis is in the spine. Any form of swelling, snake bites and such, we use it for acupuncture. We use it post-surgical to help increase circulation and reduce pain and inflammation. Obviously, in acute injuries, it's amazing. I sprained my ankle a couple of months ago, and I immediately started to laser every 4 hours. I was walking on my ankle, a little tender. That night, I never bruised, and the swelling went down ridiculously fast, and I was fully healed in under a month. Again, I mentioned snake bites and reducing inflammation. I'll show you a case of that. In ACL injuries, kidney disease, paralysis, we see a ton of degenerative disc disease, infections, skin infections, ear infections, oral infections, eye ulcers, in dentistry, of course, skin wounds, lick granulomas, muscle pain, spasm, anxiety, fractious animals. There's an unwind protocol that we use with the multi-radiance laser at 1,000 hertz that releases serotonin. Using lasers to open the lymphatic therapies, improve circulation. We've used it in bladders where there's either cancer and or pain. Prostate, phenomenal for reducing swelling in the prostate, and of course cancer. Wow, we covered a lot, but now what I want to do is really show you how it works. So we're going to cover some case presentations. My intention with the presentation is not to teach you every detail that I did. is to show you the wide spectrum of usage that we should be picking these lasers up every case that we see. So let's start with Tucker. Tucker is just a couple years old. He's a rescue, a Great Pyrenees, who started limping, and the owners took Tucker to their veterinarian, who examined him and did some x-rays and saw that he had a lesion that was becoming lytic. He was diagnosed with osteosarcoma. She transferred him to us to start our therapies, and you can see in the progression here, the swelling got worse, and we can see the lysis in the center of that bone getting more progressed. These were just some of the therapies that we did. He had his cocktails of intravenous laser, his IV Weber. We did lymphatic therapy, ion foot bath for detoxification. He was on the ion gut health and all the things that we do to support the gut. He was switched over to a raw diet. The Evo Love Raw is our food. This is him getting his different colors of IV laser. He was such a good patient. And then as we progressed into January, we started seeing that this lesion was going away. But I'll tell you, he was weight bearing within the first 3 weeks of treatment, and his entire demeanor improved rapidly. Even though radiographically the changes took a little longer, clinically this dog was eating like a horse, which he is, a mini horse, and he was bright and happy, running around, no limping, no pain. And in March, you can see that the lesion had actually filled back in again. We sent radiographs to a board-certified radiologist throughout this process, and he confirmed that the lesion was resolving. This is Chikari, a 10-year-old female spayed Rhodesian Ridgeback who presented to us with a squamous cell carcinoma, and it started in her right nostril. The owners did not believe in doing chemotherapy and radiation, and actually were told by an oncologist that she would only extend her life out a few months with those therapies anyway. So we started our whole entire protocol, 1 through 6, doing all of it. On the left upper corner, you can see her in the ion foot bath. She's in the sauna in the lower right corner. She's getting her IV therapies in the lower left corner. She was in the salt booth. She went through everything. Of course, changed her diet, IV therapies, salt booth, a lot of detoxification, chiropractic work. Our TheraGym is our light frequency machine. And in May and June, it actually started looking worse, although clinically she was doing phenomenal. And we started seeing some changes in her left nostril. But the body has to heal these things. So sometimes it does look worse as you're waking the body up and saying, hey, there's some abnormal tissue here. Because one of the reasons that these cancers are growing is because the immune system isn't recognizing them. So it just continues to grow. Well, now that we're waking the body up and we're seeing that there's a response, I actually took that as a good sign, even though it was a little scary. And then this is her live blood in April. You can see that the cells are all kind of stuck together. She's not oxygenating well. We repeated her several times, but this is her in June. And you can see that her cells look totally different. They're separated. We can tell that when we start seeing those changes in the blood, we know we're making some headway. And here was the magic. At 16 weeks in July, all of her cancer lesions were gone. We couldn't find any evidence of it. And this was in 2019. So she is rounding, next month will be her 1-year anniversary of being cancer-free. I get chills as I say that. I hope you guys are getting chills. That is an amazing story. This is Rufian. Rufian presented to us. She'd gone to an emergency clinic for acute vomiting and anorexia. She wasn't doing right. The emergency clinic thought she may have an infected uterus because she was a non-spayed female, so an 8-year-old female intact with those kind of symptoms. Pyometria is definitely one of the first rule outs. They did a quick little ultrasound scan. They didn't see anything, but they failed to do a CBC. So when I saw her a few days later, I had a white blood cell count of 47,000. So my first thought was, yeah, maybe we did miss a pyo in there. So we did want to make sure that we were very thorough in working this dog up. We did a complete workup, including an abdominal ultrasound. And what we found was it was not a pyometria. This dog had a blocked ureter where she had a stone in the ureter that had fully blocked the ureter, and the kidney was literally dying. So we sent her to the University of Florida to have the, in the hopes that we were going to save the kidney and have the stone removed. But as they did the workup, they didn't feel like it would work, and they quoted this owner over $10,000 to do the attempted surgery, and it was likely they were going to have to remove the kidney anyway. The owners didn't have that kind of money, so they referred the case back to me, and we did this kidney removal at midnight on a Saturday night. You can tell I have no personal life. And so Alyssa and I, my daughter, we jumped in and did this case. It was the hardest surgery I ever did in my life because nothing was normal. This infection had gone on for so long, and there was so much inflammation and scar tissue. And as I got down to the kidney and I was able to exteriorize it, it looked like a fountain coming out of this kidney, guys. It was pouring pus. If I would have had a third person in surgery, I would have videoed this thing. It literally was a fountain of pus just washing up and out of this kidney. And I'm watching all this pus pouring all over the pancreas and thinking, oh my gosh, this is going to be a nightmare. And so we did a lot of lavaging of the abdomen after we got the kidney out with ozonated saline. We did major autohemotherapy with our ozone machine where we infuse the blood and put it back into the animal. And of course, a lot of light therapy. And she did great. She recovered. She did get pancreatitis, and within 7 days, she was fully recovered, white count back to normal, eating bright and happy, and never had peritonitis. So it was pretty cool. All right, we're going to get into a gross couple cases here. So word of warning, but as long as we're all doctors, we kind of enjoy this. So meet Little. Little was 14 years old and had this eye tumor. The owner had taken her to their veterinarian twice already and had this tumor removed, and it grew back within weeks. So they decided to do something different, and I think the only problem here was that the veterinarian never addressed the root cause of why the tumor grew to begin with. And we went through our 6-step principle, and when I went in to remove this tumor, I did not know where that tumor was. So what did the owner ask of me before we went into surgery? Can you make sure he's visual? And I'm thinking, I don't even know if I have an eyeball under there. So we went into surgery and removed the tumor. This was all of the different things that we did throughout his procedure. And this is his post-op on the left, was what the eye looked like on the right. The tumor was actually growing from the conjunctival edge of the sclera. And we used some neoplazing in the area because I just really wanted to do a little bit extra to kill any cancer tissue. I knew I couldn't have taken the whole thing out. And there he is post-op with the size of the tumor. Look at how much that tumor had spread his eyelids. I'm thinking, wow, he's never going to be able to shrink all of that. But using laser therapy, it did. So on the left is me finding the eyeball. I was really happy about that. And on the right, 5 months later, his tumor never grew back and he was visual. This is another case of a dog that was left out in the sun. The owner's son was babysitting the dog, and the girlfriend had set the dog outside in the Florida sun. He didn't have any shade. I didn't know that at the time, so I was told in the history when the son called that the dog was having a skin issue and he wasn't able to clear it up with what he was doing at home. So he brought Max in and we did a full workup. We always do full workup on all of our cases. So it included biopsying of the skin and blood work, etc. This is what his back looked like as I was putting water to wash off all the pus. The skin was just sloughing off. The hair just sloughed off. And we had to wear masks because the smell was so horrible. We did major autohemotherapy. I did start this dog on antibiotics for a short period of time because it was his entire back. And then we were using the ion gut both topically and orally, and this is all the different things. He was in the salt booth every day. He had ozone flushes every day. We were using a lot of topical therapy, rectal ozone when we weren't doing intravenous ozone. Here you can see his back. We were trying to save the skin, but it just started cracking like a helmet. And it got worse. And I mean, the dog was feeling great. You know, it was interesting. We were not using any tranquilization or anesthesia. And Max just would wag his little tail every day. He was happy to see us. Of course, we'd already converted him to a raw diet, and he was quite the little tank when we started. So we got him to be losing some weight. Here's where it gets gross, guys. Are you ready?
Max.
This was the golden day where we were able to peel off all the dead tissue. And even though it looks kind of gross, look at how pretty that granulation tissue is underneath. So here he is the next day. When we put ozone on the skin, it bubbled it up, so we quit using the ozone. And this was him on August 31st. By September 7th, we had a 50% reduction in contracture. We were using collagen wraps by this point. And here he is in August. He had already gone home, and so we didn't get serial pictures until the very end, and his owner sent us Max's back with the state of, I guess it's the United States on there, with Florida being that little long piece at the bottom there. So this is Jim. Jim came to us after being attacked by the other two dogs in his house. Yes, that is his jugular vein that is out there for all to see. And here it was as we were prepping him for surgery. We peeled the flat back, and that was the jugular vein. So I was quite careful to not disturb anything else underneath there. And we didn't do any debridement whatsoever. We just sewed everything back up. He had two huge lacerations. You're seeing him from the ventral side. His right ear I labeled for you. If you go forward from the right ear, you can see his eye. That's over the edge, that you're looking at his ventral jaw and his neck. And then he had another huge laceration on his shoulder, which is just off to the left where you see the right ear. There's a couple stitches that you can see there. Now that was a tremendous amount of tissue damage. We had the owner come every day to laser and do ozone. We used our multi-radiance laser for this one. We literally just went out to the car and the owner was doing the lasering. And with a trauma that severe, we would all expect to see some dehiscence. You can see that the skin is all red and inflamed. This is just 24 hours post-op. And here we are every day doing laser and doing ozone. And within 10 days, he was fully healed, not one stitch dehisced. And he was eating and happy from day one. So right after surgery, that night, he went to eating and he felt terrific the whole entire time. This is Luna, and Luna bit through an electrical cord at Christmas time. The owners had some little Christmas lights along their bed, and Luna, for whatever reason, decided to chew through the cord. Now, when the owner brought her in, all she knew was that she heard the dog yelp. She saw a little pile of poop on the floor and this profuse drooling. When I opened her mouth, I could see that she had burned herself. Now, again, we still didn't know why, but the burns were very deep and they extended over halfway back on this dog's tongue. So as you're looking at that, where I have the arrows, the tip of the tongue is where her canine teeth are, where my finger is. I don't know if you can see my arrow, but it's way down here. What I knew was if I lost this tongue, this much of it, this dog would not be able to live because she wouldn't be able to eat or drink. Here is the burn going on the right side. You can see it across the commissure of the mouth. And obviously she was in tremendous pain. So every hour we were flushing her mouth with ozone, with laser, with the ion gut, with silver. We did not use any antibiotics. The picture is showing me doing lymphatic therapy because I was really wanting to get good circulation of the lymphatics in her face. So we were doing that. And within 24 hours, she was back to eating. She seemed pain-free. She acted like she was normal. The owner brought her in every day. We continued therapies. And in 1 week, not only did she not lose her tongue, but her tongue was fully healed. She has a little, like a scar there, but she's fully functional and doing fantastic. Now, I don't typically do farm animals, but Dazzle belonged to one of my BFFs. So she brought Dazzle in to euthanize her because when she had gone out to see her that morning, she could smell something was horrible. And there was an egg laid for the first time in years. And when she turned her over, she saw all these maggots. And so she assumed that it was kind of a fatal thing. But we know that maggots are good. So I said, no, we can handle this. So we started doing ozone flushes on this area, and we were using, of course, our ion gut and our, here's the laser light. And that's our red light because we're healing tissue, and then we used our blue light. This was cool because you could really see the maggots on this one. As we zoom in a little closer, I don't want you to miss any of this. It's so cool.
We're not going to use any antibiotics.
And we did not use any antibiotics. In 24 hours, there were no maggots, and in 48 hours, her tissue was fully healed. So if there's one thing that I really want to impress on everybody, it's not just that we could heal these animals, because even in our allopathic world, we get a lot of healing. But the rate of healing without any side effects and without causing the ancillary damage is phenomenal. This is Bon Jovi. And Bon Jovi had a dehorning that went bad, and the owners were trying to heal it, and this lesion would not heal. So we kept him in the hospital, and we did our ozone flushing and our red and blue light lasers. And in 3 days, we had full resolution, and he was able to go home, and he's doing fantastic. This is Fred. Fred came in. We don't even know how old Fred is. We just say he's ancient. And he had these big old huge abscesses underneath his chin. Fred had some dental issues, I'm sure, and that's where the abscesses were coming from. So we lanced it. I guess I might as well just show it, because how cool is this? And out comes that.
It's going to go all over me.
Now that's a great technician who doesn't move her hand. Kudos, Jen, for not moving and taking care of the rabbit. And here we are flushing it with ozone. And then the owner came in every day and would laser it. Here she is using the blue light with our little cone and going right into the lesion and lasering it. It did take a long time to recover, and he had a couple extra little lesions that we had to lance, but he did make a full recovery. We're going to switch gears a little bit and talk about kidney disease. This is Oreo, 7-year-old male neutered kitty cat that presented because the owner thought he had a foreign body obstruction. He had eaten a little piece of a plastic plant, and he was vomiting. So we did our full workup, x-rays, etc., and we realized that this little kitty was in renal failure and wasn't sure why. He did have a specific gravity of 1020, all was not lost, but we started doing our therapies. We did abdominal ultrasound. We wanted to be really sure. And on the ultrasound, they didn't find evidence of chronic kidney disease. He did have mild degenerative disc disease. So we started our therapies. Everything is listed on the left. Here he is getting his lymphatic therapy done. This is the machine that we use, and that's Alyssa holding him for his lymphatic therapy as I'm doing it. And we lasered his kidneys every day, twice a day, with our multi-radiance laser. And then within it was actually a little over 24 hours, but it was the next day, we repeated his blood work. And as you can see, we went from really, really high numbers, and we're starting to really move the dial and getting down close to normal. And then this is his live blood, where you can see on the left had his cells looked, and within 24 hours of our therapies, the ozone, the lasers, the lymphatics, and all of that, you can see a tremendous improvement to his blood. Here's the magic. We are 72 hours and we have normal blood work, and he has remained doing really well ever since. He is now on our Evo Love Raw diet, and he's doing terrific. This is Puddles. Puddles was 14-year-old male neutered when we met him, and he presented in renal failure. The owner had gone to his veterinarian, and the veterinarian said, yeah, you know what, he's got kidney failure, there's nothing I can do. I'm just going to keep him comfortable. The owner wasn't willing to accept that, so he brought Puddles to me on a referral, and we started doing our workup. And at first it took a little bit to move the dial, but we were able to, through our intensity of therapy, very committed owner, we were able to get this dog to have some quality of life. He did not ever go back to fully normal blood work, but he was living great with it until it was finally his time, and Puddles passed just a few months ago. But what quality of life the owner had with him. Neighbors would come out as they were going down the street and just say, wow, it looks like he's a puppy again. It was just remarkable to see the quality of life that the owner had with puddles. And this is Chloe. Chloe is a 15-year-old female spayed Chihuahua that somehow developed a deep corneal ulcer. It was almost a desmetocele, but not quite there. We did recommend surgery, whether we did a conjunctival flap or a nicotance flap, and the owner didn't want to put Chloe under anesthesia with the risks. There's her humongous ulcer. So we ended up using ozone and light therapy and topical silver and ion gut in the eye as well, along with orally. And now remember, she's 15 years old, so she doesn't have the greatest immune system. And in 4 days, she was fully healed. 4 days. I've never had an ulcer healed that fast. This is Abby. I love Abby's story because Abby came to me when she was a year old. She wasn't thriving. She was lethargic. This is literally what she looked like. She was vomiting, diarrhea, very unthriving. Owners actually got her from a friend because she was doing so poorly, and they wanted to try to help her. So they brought her over to me, and took a little while to get the diagnosis, but we ended up determining that she had a hepatic shunt. So I sent her to the University of Florida to see if she was a candidate to have her shunt tied, and it turns out she didn't even have a portal vein. So the university gave them a very poor prognosis, told them she would never thrive, would never do well. They did not want to hear euthanasia. So they brought her back to me, and we decided, for me, if you ever read my story about why I got into this alternative stuff, it was because I was told for my own horse that there was nothing more that could be done. And that was not an acceptable answer. And I vowed when I heard that told to me that I would never, ever, ever under any circumstances tell that to an owner. So I always find something to do, even if it's just getting them quality of life for even a little bit of time. I'm never going to tell somebody there's nothing more we can do, because there is always something to do. This is Abby 2 years later. She does come in once a month, and she gets her ozone and some of her therapies. Not that expensive. And watch this ball of cuteness. Notice she's thriving. She's adorable. She shows her belly. And now, actually, this is probably close to 3 years later than this video shows, and she is thriving and doing wonderful. Will she live to be 30 years old? I don't know, but for right now, we have great quality of life, and we're grateful for every day that we have with her. So there's her before, and there is her mummies with her, very, very happy. This is a picture of another hepatic shunt. We have a lot of dogs with hepatic shunts, and they're not related at all, but Bobby on the right has an hepatic shunt. He has more microvascular dysplasia, and every month he comes in for therapy, and we are able to keep his liver enzymes down in the 200 range, where when I first met him, he was in the 700s, and he has absolute quality of life. Switching gears again, we're going to talk about cruciate injuries. This is Melvin. When I first met Melvin in 2015, he weighed 93 pounds. He was grossly overweight. We worked on the owner a year to get his weight down to normal, get him on a raw diet and the right supplements, and he was doing great. He felt wonderful until the night that he blew his cruciate out. So here he is, our typical three-legged cruciate dogs. And this owner did not have the money to have surgery done. It was several $1,000s. And so she said, what can we do? This was my first time doing a cruciate without surgery. And we did multi-radiance laser on this dog, and our Magnosphere, which is our pulse electromagnetic frequency machine, which resets our parasympathetic tone and also helps with ligament and tendons and tissues and pain. And so here he is, 10 weeks of being treated twice a week, not a whole lot of cost. And on the other side, you can see him just running around. This is post-injury, and he never had a lame day again. This is Zeke. He had ruptured his cruciate a year earlier. There's your typical walk. And so for a year, the owners were trying to decide on surgery or what route they were going to take. And then we started doing PRP, prolozone, therapy, so we offered that to the client. And this is Zeke immediately following his knee injections and laser therapy, walking normally. And he's still doing great. This is Rudy. He also had ruptured a cruciate months before I ever met him. he was referred in to see if we could do anything for him. We did chiropractic work because he had a lot of arthritis, and we did his PRP and laser. This is him immediately following. You can see he can put his foot down now. He still has kind of a little odd swing. And then 1 week later, he is walking really well and continued to do so. This was a neat case. This case presented on emergency July 2nd of 2019, and they had been to their veterinarian, and the veterinarian said that he had a luxating kneecap. Well, didn't actually have a luxating kneecap. He had a ruptured cruciate ligament, and when he presented to me, he could not, Riley, he could not walk at all. He was absolutely down for the count and was grossly obese. I mean, truly grossly obese. He was 110 pounds and was struggling. So we did the prolozone, the PRP, we lasered him. I sent home a pet laser with this dog. The Multi-Radiance has a little home laser that owners can take home, and she was able to laser him twice a day. And this was a video that she took for me a couple of days after surgery.
Come on.
With her lasering.
Come on. Show Dr.
And
Siegel
Riley's the second dog.
Come on.
And he got up and walked on his own. So she was thrilled and got that on video for us.
Look at you.
And you can even hear the joy in this owner's voice. This was non-surgical. We did the injections into the joint and the laser. And this is Riley in September. Riley is now down to 85 pounds, has still not had cruciate surgery. And he'll take one little odd step as he turns the corner. But you'll be able to see, look at this guy go. Now when he takes the corner, he gets a little cross-legged. But other than that, he has phenomenal quality of life, and he walks on his leg, and he's doing wonderful. Continues to be on a raw diet and doing really, really well. Now, this is another cruciate injury that we had. This was a very recent case where we're three-legged pre-op, and then this was post-op, starting to put her foot down, and didn't get any pictures of her recently, but the owners are telling me she's using her leg. I wanted to show you what it looks like when we're doing our surgery with these guys. We had already injected her own stem cells and the ozone and all solutions that we use in our prolotherapy, and then we put the needle, the Weber laser needles into the stifle, and we use all the colors in there because we want to stimulate the mitochondria, we want to stimulate cell production and repair and all that. And it really, within 3 days, she was fully back to walking again. We also put her on a CBD product that I had the honor of helping to formulate, which is a CBD product that also has liposomal organic curcumin, chondroitin sulfate, and catnip. And so it's a wonderful blend of products that help these animals to feel better and reduce inflammation and pain. This is her with the red light. It's kind of cool because it just lights up the whole joint. Really pretty to look at. Now we're going to look at a case of a dog that had chronic skin disease, chronic allergies, and suddenly developed a head tilt. So Rocco was 8 years old, a mixed pit that this sudden ataxia, sudden head tilt. She went to her regular veterinarian. The regular veterinarian sent her to a referral center. The referral center was treating this dog, and despite all the drugs that he was on, he kept getting worse. So he came up to me, did our exam. This is him walking, and the head tilt was pretty severe. He could not lift his head straight, and he was pretty ataxic. So we started our therapies on him, and my goal for Rocco was to really ignore his symptoms and just focus on the inflammation, because the root cause of all of our diseases is inflammation. So I knew if I could reduce the inflammation in this dog, I could move the dial. This is him following his first treatment. We did, of course, a chiropractic, lymphatic, foot bath, major chemotherapy, IV therapy, and IV laser. And you can see that his head is not 100% straight the whole time, but he's able to straighten it out. I was immediately following his therapies, the first one. We saw him 2 more times after that, and again, getting better and better. And this was his live blood. You can see on the left where his blood was not the worst looking, but he wasn't the prettiest cells, and we saw marked improvement in 24 hours as we're moving that fourth phase of water, expanding it, and helping the cells polarity and cellular function. And then this was him on day 10, fully normal, feeling great, very happy owner. And here was the really cool part. For the first time in Rocco's life, his skin cleared up. And it wasn't because I treated his skin. I didn't use any antibiotics, no shampoos, no pills for the ill. We literally treated the inflammation in his body, and everything went away. And he's still thriving and doing great. This is Ritz, 14-and-a-half-year-old Jack Russell Terrier with a sudden onset of ataxia. Of course, our #1 differential for a dog with this kind of a presentation is going to be a brain tumor. But we didn't want to give Ritz a bad disease. We did his exam and saw he had a horrific ear infection. So we did an ear flush. We started lasering both with our red light and our blue light. With the tip on this machine, we're able to focus the light waves and go right down into that ear, non-painful. And this is him 24 hours later, literally one day back to normal. This is a snake bite that we had that came in with the swelling. And we're in Florida, we have a lot of venomous snakes. So typically when we have a snake bite and swelling like that, even after we are able to stabilize the patient, it usually takes days and days and days for the swelling to go away. But we used our ozone and our laser lights, and we worked on the swelling, and we pushed it down into the lymphatic drainage points. And 36 hours later, this dog had no swelling. This was her live blood. A snake bite classic presentation is to have all echonocytes, and that's what we see here on the left. So that was a pretty pathognomonic vision of what we were dealing with. And then 18 hours later, this is what the blood looked like using our therapies. And of course, clinically, you can see the dog improved dramatically. This was Uno. Uno had a severe ulceration of her vulva and her thighs. And at the time of presentation, these lesions went all the way up her ventral belly. So her whole entire ventral belly, she's a German Shepherd, so it's a big dog, was severely ulcerated. She went to the University of Florida. They put her on 2 different antibiotics and just tons of medications. And she got better, but she didn't get all the way better. So she came in, we started doing our therapies. I hospitalized this dog because I knew she had exposure to glyphosate in her own yard, and I wasn't sure what was really burning this dog. And it was when I was with her in the hyperbaric chamber, we had a soft side chamber, so I'm oftentimes in the chamber doing the dive with these dogs so they're safe. And I just happened to see a little drop of urine coming from her vulva. So I realized that she was having very, very minimal amount of urine discharge. Owner didn't describe anything about puddles at the house or anything, but she was getting burns from some of the urine scalding. So we put her on a product to help keep the urine from dripping. And then we treated her just with ozone, laser, and hyperbarics with our silver and our oral supplementation and our ion. And she fully recovered in 1 week. This is Pistol. She had a little argument with some of her housemates and got this big, deep gashing hole on the inside of her thigh, which was infected. She was also nursing puppies, so we didn't want to use a lot of antibiotics, and the owner was willing to come in every day and do lavaging with our ozonated saline and to laser it every day. So here we are progressing. You can see the dates at the top. So within a few days, we already had the lesion filling in, and within 2 weeks, we were pretty much healed up. It was just a couple more days and she was fully healed. This was Jim again. We don't need to see Jim twice. Sorry for that. This is a little deer that came in, and she had been hit by a car, and we used her, we gave her ozone and stabilized her, and I did have a picture of her. I guess we're going to pop into our intervertebral disc disease cases, which we all see a ton of. We see a lot of paralyzed animals that come in, and we're very blessed to have these animals walking within a very short period of time. This was a dog that presented with back pain, and radiographically you can see how his back looks like a little S-curve. That was not positional. That is really what he looked like. We had a technician at the head and at the feet. We were pulling him, seeing the plumb line straight. He was in a trough to keep him straight, and that's how bad his back was. There is thermography showing all the inflammation that he was having at that time. We did his chiropractic adjustment, lasered him. You can see all the different treatments. And then in 1 week, you can see his back is now straight and all the inflammation is gone. And the owner reported, of course, within the first 24 hours that the dog was feeling fantastic, better than ever. This was Kim. She did present with intervertebral disc disease. She had been paralyzed since December. She had gone to a referral center. The people did not have enough money to do the surgery, so they had been looking for some solutions for her, and they were referred in to see me. We hospitalized her, and we're going to do 7 days of intensive therapy following our protocol. This is her as she was paralyzed, and you know, even the owner was so upset you could hear her crying in the background. And then on day 4, she was able to stand. I don't want to spend the time doing it, but the video on the right, she actually moves her own foot. And then this is her 14 days later with a haircut. And she has not had a problem since. That was 14 days. This was Daisy, also had presented with an acute paralysis. I was out of town at the time, so they went to an emergency clinic. The emergency clinic told this owner to put her down. That she did have a history of having mast cell tumors, which we were treating her for. And the emergency clinic said she's not going to recover, so you might as well euthanize, and they did not want to do that. So here is Daisy just dragging herself along the floor. We did all of our typical things, and here she is 4 days later, being able to actually walk in the parking lot. So that was 4 days. Happens to cats as well. This was Sammy, 15-year-old spayed female who had a sudden onset of paralysis. They went to their vet. Their vet referred them to a referral center. The referral center assumed that this cat had lymphoma in the spine and told the owners it was a poor prognosis and they should euthanize. The husband knew me from a B&I group that I was in, and he decided to give me a try. So we agreed that we were going to give her 2 weeks and see what happened. And in 4 days, we were able to get her to crab walk. And if she had never progressed from here, they would have been happy because she could use her litter pan. But we didn't stop there. And in 4 weeks, she was walking normally. She is now 3 years later and still doing phenomenal. They actually reported that she's doing better now than she did before she got sick, because she's so much more vibrant. And we followed our 6-step principle, and she is now eating a raw diet and she's thriving. This is Ireland, also presented for euthanasia because the owner was a nurse, and when she presented like this, he didn't figure that anything could be done. And I said, not on my watch. And we did all of our workup, all of our treatments, and this was her 3 weeks later, doing phenomenal. Very rewarding to see these guys improve. Of course, it's always wonderful when you get them before they get paralyzed. Prevention would be wonderful. And if we can get these animals on species-appropriate diet and reduce the amount of inflammation in their body so that they don't have these disc herniations, it would be ideal. This is Pepper, just give a quick example of all these different cases that have come into us that were paralyzed, and we do all the things that we do. We saw improvement just in a couple of days. She's able to get her butt off the ground, and my floors are slippery, so that was challenging. Then she could crab walk but still arched. And then this is her.
Come here, look at me.
And she has been phenomenal ever since. And the owners do maintain her lifestyle. So as we start wrapping up, I began my presentation telling you that owners ask me if I can get their pets to live forever. And I think as veterinarians, sometimes we forget the value of one more day. So just for a moment, think about what it would mean to you if there was somebody that you've lost, a person or a pet, someone very, very special to you that has transitioned, And what would it mean to you if you could have one more day with that individual, to say whatever you want to say, to have one more kiss, one more hug, just to hold their hand? What would that be worth to you? And that's what we want to give to our clients. They're really not asking for forever. They're asking for one more day of quality life. And thank God we have the tools that we have that afford that to these animals. This is an 18-year-old that came to me, and Mom just wasn't ready to say goodbye. We did her workup. She was head pressing, going in circles, and could not sleep at night. That's what the biggest part of the problem was Mom wasn't getting any sleep either. And here she is, just head pressing and circling. We did her x-rays, and you can just see severe spondylosis. Her back is arched. Bless her heart, she just had to be so uncomfortable. We did our full workup, and I get this text message. Guess who got 8 hours of sleep? That girl. The joy that this owner had, that in 3 days we could get this animal to have quality of life, was priceless. And she lived over a month longer. Now, some people would go, well, gosh, it was only a month, you know, why bother? But for this owner, that month was the most special month. She was able to sleep with her every day and really value the fact that she had a few more days of quality life with her. And this is Prowler. Prowler came to us a year ago with a liver cancer, a huge liver cancer. You can see that she's quite overweight herself. And the owners just weren't willing to give up. Their vet had told them that there was nothing more that could be done. So we started our therapies, and they didn't have a lot of money, so we really treat her once a month, sometimes twice. But we started doing all of our therapies, and these owners were so committed. They own a gym, so you can see that she is quite part of the family. She is very, very important to them. And within a few months, we were just seeing this dog shine. I mean, we could see changes within 2 weeks. She was improving, and we are now a year later, and she is still with us. And we just ultrasounded her a few weeks ago, and according to the radiologist, the ultrasonographer, there is no evidence of cancer in her liver. It's still big, but there's no evidence of cancer. So we're coming to the conclusion of our time together, and I hope that I have helped you to have some beliefs shift. I hope that we've made some paradigm shifts so that you can take some of these examples, things that you see every day in your practice, and know that there is always something that you can do. And when we have the right toolkit, we can do so much good in the world. And that doesn't mean that your allopathic toolkit is bad. I call it integrated medicine, because we can take the best of the allopathic world, which is a lot of great things there, with the best of the alternative world, and put them together and achieve phenomenal outcomes. So thank you very, very much for sharing your time with me.
Yeah, hello again, everybody. Hello, Dr. Siegel.
I have my photo bomber with me.
Oh, I see, I see. What's his name or her name?
Thank you. This is Echo.
Echo. Okay.
Yeah.
Nice to meet you, Echo.
Every time I'm at home.
Great. Well, thank you for that amazing lecture. I think everybody could see why we always love to have you speak at our conferences.
Thank you.
And so we will only have 25 minutes now. And I know it's not enough time to cover everything people want to know. I know you're an avid blogger, and you're also very active on social media. So before we go into the detailed questions, would you like to tell us how people can find your more information about what you do?
So my website is pascovet.com, PASCOVET.com. On the last slide of the presentation, I had my raw food company website up there. And then I'm on Twitter, I'm on LinkedIn under my name. On Facebook, it's under my name. Under Instagram, it's under pascovet.com. But if you search my name, we're trying to make it very easy. We're having our team put together easier social media, but the website has the link to everything. So if you go to pascovet.com, you can access YouTube and everything.
Mm-hmm. Okay, perfect. I think Claire just posted the link in the chat box, so you can just copy it from there. And I think now it's a good time to talk about the protocols and how they look like in detail.
Okay.
And let's start by talking about the IV application. So first of all, people would like to know, do the animals have to be sedated?
No, they don't. We just need to put an intravenous catheter in, which in our world, we put them in all the time without sedation, unless you have a fractious animal. I will tell you, for my cancer patients now, we put in an IV port. It's a long-term port where we can do all the intravenous medications, but the IV laser is still done through a 22 or 20 gauge IV catheter in a peripheral vein, because the ports are very long and the IV catheter isn't long enough to go out into the bloodstream. So we use a peripheral vein with a 22 or larger IV catheter, and that's done without sedation.
Mm-hmm. Let me quickly mention that the endolaser system from Weberneedle has different applicators. So if the IV needles are not long enough, you can also use what we call interstitial needles, and we have them in different lengths from 4 to 12 centimeters. So basically you can always reach all areas of the body.
And that's what we do with the cruciate, is we use the interstitial needles, and then we put the laser through that.
Perfect, perfect. And how does a typical IV protocol look like? And do you always use all colors? Or if not, what does it depend on which colors you use and for how long do you use them?
So we typically will use 10 minutes per color. It depends on what we're treating to whether or not we use all the colors. But when we're doing our cancer therapies, we are using different photo activators. So we'll use poly-MVA, we'll use curcumin, and they're activated at different colors. So we want to make sure, nice when we have the port, because we can be infusing with the IV chemical, and then we can be using the right color that activates that particular chemical. Those protocols are all written up.
It's great that you mentioned the photosensitizers. Which one do you use for cancer therapies?
We use them all. So we use poly-MVA, we use curcumin for our sensitizers. Financially, it's not economical yet to use, some of the other ones that are out there, like the ICG. I would love to be able to do that, but it hasn't gotten to the point where it's economical for the volume that we use. And then if you don't have another case right behind it, it's just really pricey. But I would love to be able to do that, because that gives you longer time before you have to infuse something. So I use all my colors to answer your question, and average time is 10 minutes per color. So it takes about an hour to do all the colors.
The ICG is what we use in human medicine to treat cancers, but I totally see a point in what you said. I think it's a bit too pricey for veterinary medicine right now.
Yeah, I think it was like the 10 milliliter vial was like 2,000 or 2,400 or something like that. And once you open it, you have to use it. And so it wasn't in our price range. I almost did. I almost had 3 cases all together, and all 3 owners were going to try to share the bottle, but it didn't work out.
Yeah, so it definitely is an option, but it might be too pricey. Yeah. Could you tell us about your protocol to treat the lymphatic system?
Love to. That's one of my favorite things. In fact, we are, myself and Dr. Jennifer Gramuth, who is the person who has put these protocols together and actually is the person who put together the machine. She and I are doing a training for veterinarians. So she has set me up to be the veterinary side of the training program, and she does the human side. So it's a machine, and it uses negative currents and negative ions and microcurrent with inert gases, and they're 2 glass probes. So the way you do it is to open the different points of the lymphatic therapy. So I'll demo on echo here. So this would be our starting point, and then there's various areas in the body that we go to, and then we decongest by doing circular motions, and then we sweep into each drainage point. So the body has specific areas that it drains to, and so we facilitate that. And we found that it is an amazing process for helping to move toxins and boost the immune system. And it's an area that's been very ignored in human medicine and animal medicine, because no one had a treatment for it. So if you don't have a treatment, you tend to pretend it's not there. It's your elephant in the room. Well, now that we have this therapy for it, we find that it is magnificent. And I actually did some live blood studies where I took an animal before the lymphatic therapy and then immediately after, and I showed the difference. And there's something about whether it's the microcurrent or the inert gases or whatever's doing it, but it changes the fourth phase of water literally while you're working on that animal. So 20 to 30 minutes later, you go from a lot of clumped red blood cells to absolutely gorgeous separated red blood cells with a lot of movement, really active.
Mm-hmm. Perfect. Yeah, I'm trying to be as quick as possible so we can cover everything, hopefully.
Right.
So could you tell us about your protocol to treat chronic lameness in the forelimb of dogs?
So the 6-step principle, you got to stop doing the things that are causing them to have inflammation. So improve their diet, improve the environment, make sure you're healing the gut, make sure that all the essential nutrients are on board. On my Evo Love Raw website are a list of all the products that we use. And then from there, we do chiropractic work. We always, of course, x-ray, and we make sure that we know what's going on with the spine and the limbs, make sure there isn't a cancer there because sometimes they're lame because of a different disease. So always, always, always do a good workup. Do not just do a short fix and think that you got it, because you're going to get burned when you do that. And then from there, we do our chiropractic work, we laser, we use our anti-inflammatory protocols, which vary in some cases from pet to pet and what the owners can afford. But it's really a very simple process. And our animals, we can see a difference in them immediately following chiropractic, acupuncture, laser combinations. And sometimes an owner can't afford all of that. So we'll pick and choose the one that we think is going to be most effective.
Mm-hmm. Do you also combine it with PRP therapies?
When we do our injections, we do, yes, but not all lamenesses require that. So I showed you, I think, 3 cases where we did the PRP, prolozone, and intra-articular laser therapy.
Yeah. Connected to that, we have a question. Did you ever consider to use human blood, maybe from the owner or another person, on the animal?
No.
You think that's a good idea, or
no?
Rather not?
No, I think you're going to run into problems with antigen formation. In fact, we were looking at trying to get some PRP from humans and worked with the companies, and they didn't think that was a good idea either. I think you're going to get some antigenic stimulation that would not be appropriate.
That makes sense, yeah. Do you have a protocol for better aging or anti-aging?
6-step protocol. You got to stop doing the things that are causing the damage. And we know that when we stop creating inflammation and you start doing high intensity exercise, which we can do with our pets as well. Obviously, you don't do it day one if they've never done it. And if they're a big old fat spud, you don't want to put them in through that stress. But you can do things like swimming and treadmill and working up. But it's about making these animals healthier, and you can increase their telomeres. It's laser therapy is fantastic. Doing things that release nitrous oxide. We talked about that in the slide presentation. With our multi-radiance laser, we do something called photobiomodulation, and we take the laser on 50 hertz and we put it over a site like the femoral vein. And when we laser that, it releases nitrous oxide. We can do it with the Weber laser. We can do it with the Weber watch.
I think that's a great thing about your protocol and your very comprehensive approach that aims at true healing in general, that it always also leads to better aging or better health at age. Absolutely, yeah.
Absolutely. But it's not one thing, Martin. It's a lifestyle. You can't take all these wonderful nutraceutical supplements and then go out and eat a non-organic cheeseburger that was fried in canola oil, right? There's a point where we have to take responsibility and we have to decide what is our life going to look like. And it's making those decisions on how we spend our dollars, right? You can buy these toxic house cleaners and products like Tide. I don't know if I'm allowed to say things like that, but let's just say the traditional laundry soaps that are full of xenoestrogens, and you're 24/7, you've got this stuff touching your skin, and your animals are, well, I got my guy, he's laying on my lap right now, or he lays on my bed, or, they're exposed to these same toxins. So we have to start really going through in that 6-step protocol. The whole first step was all about reducing the toxicity in your environment. We have to make a concerted effort to do that. Open your cabinets and see what's in there And if it's not healthy, get rid of it. If there's more than 3 ingredients and you can't pronounce the names, pretty good clue that it's not going to be something good for you. And I love doing DIY projects, using essential oils, using natural products. There's so many wonderful things out there. I love the, I gotta say this carefully, I love the ramification that the whole COVID thing caused, because people had shortages and then they had to either be in fear or they had to get creative and find solutions. I was a let's creative and find solution kind of girl. So we started making more of our own hand sanitizers and disinfectants, and we use hypochlorous acid water. And so there's just wonderful opportunities there. Water, you know, we could talk about water for hours. I am a water snob. There are 65,000 toxins in tap water. So if you're using tap water for your pets or you're cooking with tap water, stop it. I'll share this, which is make it easy. Take a piece of paper, guys, fold it in half. Column A, column B. Column A are all the things that you should be doing, but you're not doing them yet. Column B are all the things that you shouldn't be doing and you still are. Pick one thing from column A, start to do it till it's who you are. Take one thing from column B, stop it. there's no other way to do it. Just stop it. And then when that gets comfortable for you, go back to your list and pick something else off of column A and off of column B, and start making the changes in your life. It absolutely is priceless.
I think we could do another webinar just about that, right?
Yes, absolutely. It's all decisions. You know, we have our choices. We have our ability to make decisions. We can pick and choose, and we spend our dollars. Your dollar is your vote. So are you going to spend your dollars at a restaurant that is serving you toxic food? I don't care if it tastes good, but knowing that you're going to be more inflamed when you leave there? Or are you going to go to that restaurant and very nicely say, I can't eat here until you provide something that is of quality service? It needs to be good quality oils that aren't rancid and aren't toxic, and that you have organic options. I'm not saying that they have to change everything on the menu, but they should at least provide something, right? And then we start making the shift in the world. But if we just go back to the world that we were in and we don't ask for changes, if we don't demand those changes by our behavior, then it's not going to change.
I totally agree. I also think we have to take that situation as a big opportunity to really trigger sustainable, long-lasting change. Definitely, absolutely.
Yeah. And it can be done. Our last ISLA conference, when we were all together this past January, Jennifer, bless you for doing this, but the entire menu that we served people for 3 days in a row was organic. All day. Breakfast, lunch, and dinner. And so hotels don't mind doing that. They need a heads up, and then they need to know what they can do. And our chef actually came out, and he was so excited. The whole place was just cheering him. Here we are talking about cancer. Really, do we want to be eating toxic food while we're talking about curing cancer? I don't think so. So the first year I spoke at ISLA, that year the food wasn't organic. And this year it totally was. And I was really honored by the fact that I got to inspire them.
Yeah, it was a very valuable recommendation. Thank you for that. And I'm excited to taste the food we will have when we do a seminar at your clinic.
All organic.
Let's get back to protocols. Do you have a protocol to treat mast cell tumors?
Yes, I do. And they do follow the same basic protocols. There's a product that I use called neoplazine, and it works really, really well on mast cell tumors. There are some nuances there because the neoplazine doesn't play well with a lot of other antioxidants. It diminishes its effect. So you really have to take the patient into consideration and see how stable they are and what is your first priority in helping them to get a strong immune system. So I always start with detoxification, which wasn't asked that way, but detoxification is the absolute first step in our protocols. It's so important that as of 2 days ago, I just signed the contract to launch SPAWS, P-A-W-S, and SPAWS is our detoxification centers for people and pets that will eventually be worldwide.
I was about to ask you that anyway. Can you tell us some more details about that project?
So SPAWS is a project where we are opening detoxification centers, we're calling them, spas, if you will. And so we certainly don't want to make it look like we're practicing medicine without a license. So we are not. The clinics can be owned by a layperson, and they can do just detoxification services like salt therapy, our magnosphere, our lymphatic drainage. Those are all services that don't require a veterinary intervention. And I'm trying not to sneeze because my cat's on my lap. Those are just a few things. We'll have hyperbarics in there as well. We'll have laser therapy available for our pet owners to use on their pets. And these are all services that do not require a veterinarian involved, but they're working on all 6 organs of elimination. As I said before in the lecture, kidney, colon, lungs, liver, skin, and lymphatics. So once we get the organs of elimination open and flowing, now we can go in there and start pushing the immune system, increasing energy, and start creating the apoptosis and the cancer-killing cells.
Sounds like an amazing project. Will you be able to accept all kinds of animals, or are there limitations?
No room for horses inside the building at this time, but thank you for suggesting that, and maybe we'll make a little barn area where we can have our horses come in as well. I don't see any reason why not. Thank you for the suggestion.
Yeah, might be a big building, but I think it's possible.
Hey,
sure.
Put a barn on the side, no problem. We can handle that. Yeah.
Mm-hmm. Let's quickly talk about cancer therapies again. So what do you have to consider when you have an animal with cancer and you do an IV therapy, but you don't use a photosensitizer? Would you do that? Or normally we say it's contraindicated. So can you tell us a bit more about that?
No, it's never contraindicated. When we do our ozone, we do something called major autohemotherapy with UVBI, ultraviolet blood irradiation, which has been done for a very, very long time. And that's basically light therapy. We draw blood from the patient by volume of their body weight, and then we mix it with ozone, and then we run it through a UVBI light therapy. So the blood is actually being irradiated with this UVBI light, ultraviolet blood irradiation, and then we put that back into the patient. So in a case like that, we're not using photosensitizers necessarily. It's not that you have to use a photosensitizer with it. You will get better efficacy if you're doing your IV laser therapy and you're giving yourself extra help by using the photosensitizer, because now you're targeting a cancer tissue and helping to really light it up and create that apoptosis effect.
I can recommend to watch the 5th webinar that we had. I'm going to send all of you the YouTube link again. We had Dr. Michael Weber talking about photodynamic therapy for 1.5 hours. So I think you can get a lot from that if you want to listen to that lecture again. So I'm checking the chat box right now. I think we have one last question, and it's about the differences in effects between the blue and red laser. Can you tell us a bit more about that?
So each color frequency has a different spectrum. And so their effects are going to be a little different. And, without spending a lot of time and going through each different color, your blue light is phenomenal for antibacterial effect. Your red lights are phenomenal for increasing energy production and increasing the ATP production in the mitochondria. So those are kind of the big picture, but I think full spectrum light is effective in ways that I don't even think we even know yet. We certainly know that there are some elements that we can track, but when you're standing out in the sun and you're receiving full spectrum light, your cells are taking what they need. And that's another principle that I think we've become very short-sighted on. When I use my magnosphere, which is my pulse electromagnetic frequency machine, we're allowing the body to select the frequencies that it needs. And then whatever it doesn't need, it just discards it. We use a machine called a Quest 4, which is a bioenergetic scan. And we're looking to see what are the frequencies in the different systems that are out of balance, and what frequencies can we give the body to put it back in balance. Well, the beauty of stuff like that is that if the body doesn't need it, it just discards it. If it needs it, it'll take it and it'll use it. So when we're using these different light therapies, I almost think of it as a smorgasbord. So we're giving the body the opportunity to take something at a time when it needs it and utilize it. And then when it doesn't need it, no harm. It's just going to discard it.
So I think it's safe to say laser therapy in general has no side effects, right?
No negative side effects.
Right, yeah,
I'm
right.
sure somebody could come up with something that's negative, but in general, I find that if you use it within the guidelines that we're taught, that it is safe, it is effective, and it is one of the most valuable tools that I feel in my practice.
Thank you. Dear attendees, if you would like to learn more about the different effects of the different colors, I recommend that you watch the webinar 1 and 2 again. And yeah, as I mentioned before, you will get all links again. So it will contain all information you need. Yeah, so I'm checking the chat box again, and I see one more question.
Awesome.
Oh no, it's only praise for you. People are saying that you gave an amazing lecture and are very happy about it.
Thank
They said
you.
thank you.
Thank you. Thank you.
So I think it's time to end today's session. And it's also the end of our whole webinar series. I had a lot of fun doing this with all of you. And I think it was a great end. It was my favorite topic today. And I'm very happy that you came and you had the time to do this with us.
Yeah.
Thanks a lot.
It was a lot.
And I hope everybody could learn a lot about low-level laser therapy, about its big potential, and I think it's surely on its way to mainstream medicine. The number of publications is going up exponentially, and I will also send you a link to a low-level laser therapy database, and I think it already contains 4,800 plus studies about low-level laser therapy. It's so much research going on, and I think there is a big budget in the US right now for research in that area. I think up to 500 million US dollars. I think it was released last year. So there's much more to come. And I think we can all be excited about the future of laser medicine. Yeah, do you have anything to add?
I just want to inspire everybody to go within and find out what it is that you're here for. What is it that you can contribute by taking action? It's great to learn. It's great to listen. It's great to expand your mind, but you got to do something with it. So now take action, whether you buy a new tool, whether you start changing your living habits, whether you make different decisions about how you're going to show up in the world, whatever that looks like for you, take that first step. Make a difference in your life, because you're going to make a difference in the world when you do that.
It's a great ending, I think, and couldn't say it any better. Yeah, totally agree. Yeah. So I see some praise for the whole series, and I would like to thank all of you for that. I think we are surely going to do another series, maybe in a couple of months, half a year maybe, and I hope we can do it together again. Yeah, and I thank all of you for attending, and please feel free to let us know if you need anything. You have my email address, you have Claire's email address. You can always reach out, and we'll be happy to help you and provide more information about that exciting field of medicine.
Excited to join forces with everybody. Thank you so much.
Yeah, and I look forward to seeing you again soon. I think at latest probably in February, because I think our next conference will be the US conference. We just had to cancel the one that was supposed to take place in Germany, of course, because of Corona. And it's also very unlikely that we can have our Bangkok conference this year. So I think that will be our next conference, hopefully. Well,
hopefully it's in my event center. We got 9,300 square feet of an amazing event center and our own commercial commissary. So we'll have all on site.
Sounds amazing.
Yeah.
So the webinar room will close in 1 minute and 40 seconds. So it's a good time to say goodbye to everybody, and yeah, see all of you again pretty soon.
Bye.
Bye-bye.
You did a great job. Thank you so much.
Thank you. Thank you. Bye-bye.
Bye.